Dr. Bogaards, what are currently the challenges out there in the market with regard to image-guided therapy?
Well, thank you very much for asking the question. In image-guided therapy, we see several challenges. And one is that the complexity of the procedures is increasing. And so there is a need to connect more and more imaging modalities together because the procedures are increasing, the devices are increasing. Sometimes it's not known in advance which modality can suit best, and each modality has its own advantages and its own strengths. And this is why we see the need to connect all these imaging modalities together. So we want to closely integrate them together to in the end have a better product. And for this reason we work together with companies to come up with solutions in this space, like Getinge.
Mr. Christian, what's the offering of Getinge and Siemens Healthineers with regard to image-guided therapy challenges?
Well, the challenge is really to find out a solution where we have a patient then coming from the angiography room to the magnetic resonance room. We have a very good solution with a combination of an Pheno system, an angiography system, fluoroscopy, and together with a sliding CT. But now the question is coming how to bring the patient over to the magnetic resonance and how to transfer without any lifting. And that is what we are offering today. We have a new table system developed together with the advanced therapy group where we bring the patient on a transfer board very smooth over on a CombiDoc, and from the CombiDoc then to the MR so that we can have a diagnostic and the customer can decide whatever he wants to have. He can decide between the angio, he can decide to have a CT scan, or he can move over to an MRI in the preoperative phase, intraoperative, or in the postoperative phase.
Mr. Roberts, what is the offering of Siemens Healthineers with regard to MRI and intraoperative imaging?
So with intraoperative MR imaging, one of the classic cases we see is for intraoperative neurosurgery. And if we look at the cases for tumor resection for neurosurgery, patient has a tumor which is being resected, and then in order to control if the surgeon has resected the entire tumor or not, they need to do intraoperative MR imaging to make sure that they've resected the entire tumor. So the patient's on the OR table, they do the procedure, the normal tumor resection, then the dockable table from the MR comes, is docked to the OR table. The patient is then transferred on to the MR table in the same treatment position. Then the patient is driven to the MR. They do an intraoperative MR scan. And then from there, the clinicians can see, have they gotten a complete and total tumor resection or not? And if not, then they can drive the patient back to the OR table, move him back, staying in the treatment position the whole time, and then continue with the rest of the surgery, the entire treatment, complete the tumor resection, and then can close the patient up. So they don't have to close the patient up and then go back and do a second surgery. And that's the really classic nice case with intraoperative imaging for surgery.